Back now, world-renowned Dr. Michael Obeng is in South Africa. The Ghanaian-born plastic surgeon founded the Restore Worldwide organization. Now, what it does is support doctors who provide medical assistance in developing countries such as Ghana. In his capacity as the only African plastic surgeon in Beverly Hills, he's made a name for himself as the surgeon to the stars. Thank you so much for joining us and welcome to our shores.
Thank you, Faith. Thank you for having me.
Now, it's you know, this Restore, and I will talk a little bit about Restore in a moment in terms of the organization that has really done phenomenal work in reconstructive surgery, and I would say it's a passion project that has extended legs over 10 years. But to be known as the only African plastic surgeon in Beverly Hills, my goodness, to own that title. First of all, why are you the only African plastic surgeon? But second of all, clearly you're unmatched when it comes to your skills.
Thank you. You know, being known as the only African plastic surgeon in Beverly Hills, I don't think is an honor. And the best honor is being truly believing that I'm the best plastic surgeon in Beverly Hills. The best plastic surgeon.
So we should just change it and say the best plastic surgeon.
Just being black, you know, and being from Ghana, and it hasn't been done, and you know, it brings a lot of attention to you. But you know, I've been blessed to be where I am today because of my humble beginnings from Ghana. You know, growing up in Ghana, seeing a lot of diseases and illnesses and deformities that were attributed to supernatural forces, such as witchcraft. And, you know, to see the agony my grandmother and my mother went through, you know, these are some of the things that propelled me to seek a career as a physician and ultimately as a plastic surgeon. Yeah.
So, I mean, when you're talking about certain challenges that you witness, especially while growing up in Ghana, where, I mean, it's not even a Ghanaian truth, it's a African truth, really, where some defects are seen as either witchcraft or being unfavored by ancestors or being unfavored by the gods, and this individual actually lives in shame all their lives when it actually literally could be solved with just one plastic surgeon. I mean, we used to see cleft palate as almost a huge travesty in communities when all it was just a birth defect that could be like literally mended immediately.
You are absolutely right. This is something that happens in Asia, it happens in Europe, it happens in, it happens in America. And all it takes is doing the, you know, how the body's formed, how the lips are formed, a little click, a little glitch in it. They don't come together, and then you have a defect. This takes only 30 minutes to fix. And the reason why we don't see that in the Western world is because as soon as they are born, within the first 3 months, they are having surgery. Because of the shortage of plastic surgeons on the continent, and also in South America and some of these developing countries, these people live on until they're adults. And some of these don't get a chance to even go to school because of the fact that they are shunned. And this is not right. This is something that's easily fixed. And that's why we as Africans, we need to build capacity in, you know, in things like reconstructive surgery.
Yeah, I mean, hence why one would say that maybe Restore actually exists, right? Because, I mean, the actual, you know, Restore actually means restoring emotional stability through outstanding reconstructive efforts, and that is worldwide. And what I like about this is that you mentioned the part of outstanding. In other words, don't do this just because you can. Do it with an actual intent of making sure that excellence is at the forefront.
That's correct. You know, so the name Restore, just going back, Restore came to me back in 2007. But it was a seed that was planted in my head when I was in training, when I was in medical school, I believe in 1999. John Miller, who was one of my professors, put a bug in my head. John Miller once told me, "Michael, you're from Ghana, right?" I said, "Yes, sir." So why don't we go to Ghana and do free surgery? But John Miller put a seed in me, not knowing that this is something that was going to be so big. But of course, I would never take full credit. Now, Operation Smile was an inspiration. At the tender age of 15, I witnessed firsthand the power of plastic surgery when I saw a neighbor who had been disfigured from acid burns when her boyfriend or husband poured acid on her. I saw how it affected her emotionally, and after plastic surgery came into play, after I was corrected, I saw the emotional stability, how she came out, and that's how the name Restore came about, you know, restoring emotional stability. Because when you have a physical disability or a physical deformity, a lot of times it takes a toll on your psyche, you know, depression, just unwillingness to go outside and mingle, and it affects so many things, and affects not just you. Because once one person is not happy, it affects the whole community. And that's why restoring emotional stability through outstanding reconstructive effort was such a key to me when I was coming up with the name for my organization.
Now, these are pro bono cases that you take up, because, I mean, you've taken up about 700 in the past 10 years.
That's correct.
So if they are pro bono cases, I mean, how then do you start deciding on which case to actually pick? Because, look, there's some individual who come up to you and say, listen, my emotional stability has been affected as a result of, where it literally goes into the cosmetics, because my nose is not as small and slim as I want it to be, so you need to fix it so that I can be an emotionally stable person. So then how then do you start deciding that this is a case that we take up, this is a cause that we're going to stand up upon? Because otherwise you're going to get an array of people, which I'm sure you do, who come to your practice and say, doc, fix me, make me emotionally more stable.
This is a very interesting. So yes, every country we go to, we come across somebody who says, oh, my boobs are too small, my breasts are this, my lips, my nose. And I've actually done a lip reduction in Ghana because it was so big. And
wow.
Yes, it consumed over 60% of the lower third of the face. It was so big that I had to. But most of the cases we take cases that, number one, we can deliver. Number two, is safe, because you don't want to go to a country and have a mortality, have somebody die on the operating table. Yeah. Then that will mess it up for any organization trying to do good on the continent. So we choose cases, and we choose them wisely. The cases that are taken on based upon functional restoration. So we put function first. So especially children who have been born with, with congenital, born with contractures after burns because of lack of physiotherapy. They have contractures, so those are number one. We try to release them as soon as possible so they can have functional mobility and they can use it. Children with cleft lip and palate. But when it comes to noses being too big and certain things, it doesn't really improve function. Of course, if somebody came to me and they have difficulty breathing because they have such a severe deviated septum, that will improve function, because then it will help them not to snore at night. It will stop snoring and they can breathe better. And they can sleep better, because a lot of times those patients overnight, they don't sleep, and then they go to work and they are tired throughout the rest of the day. Yeah. So that's a functional capacity that we have to restore.
And then just looking at where healthcare is at on the African continent, one may say that we're lacking behind severely, especially for those individuals that do not have private medical care or medical aid, so as to say. So when you go into a specific country and you actually pick a case and you oversee the reconstruction surgery part of it, that individual has to heal. And unfortunately, the context of many African countries, there are public facilities, healthcare facilities. How then do you ensure that the public health facility actually ensures that the work that you've performed is seen through to the finish? Because it's one thing to perform a surgery, but it's another thing to see it up until it's actually the person gets out of that bed healthy as a fiddle. You don't want somebody dying just because of neglect, as opposed to the way in which the surgery went.
So, Faith, you've hit a point that a lot of journalists have never asked me. Surgery is only 30%. The aftercare is everything. So one of the things that Restore do, not only we do surgery, after surgery, I usually will stick around for one more week, but we train people. We train the doctors who are interested and the other healthcare professionals to carry on the care, taking out sutures, making sure that they are getting adequate physical therapy. So all these have to be in place, and you're absolutely right. If these things are not in place, the contractures will come back. The wounds will separate. Some of these, you will have complications that should not come about because of aftercare. So aftercare is very important, and we stress it. We stress it out to the facilities, and usually I will stay behind for another week, even when the surgeries are completed. So that's absolutely correct. But one thing that we are lacking in Africa, our healthcare priorities are not right. We, as a nation, as a continent, we don't put emphasis on healthcare. Healthcare is the last on our list. And if you look at communities, the Western communities, Africa accounts for 15% of the world's population, 1% of the expenditure on healthcare. Just figure it out. We need to build better infrastructure, capacity building in personnel. We talk about different countries. Plastic surgery, for example, in my street, in just 1 mile radius, there are over 250 plastic surgeons in a 1 mile radius. In my building alone, five-story building or 4-story building, there are about 8 plastic surgeons. In my street, just Roxbury Drive, there are over 50 plastic surgeons. Okay, this is just to give you perspective. How many plastic surgeons are around? Compared to Africa, of course, I don't know the whole number, but I can tell about certain countries. Togo, for example, a population of 11 million. does not have a plastic surgeon. Gabon, 1.2 million, does not have one.
Does not have a plastic.
Congo,
does not even have one.
No, Congo, Brazzaville does not have one. So these are some of the countries that I've personally been to. From now, I leave here tomorrow, I'm going to Uganda. I'm going to Kenya. From Kenya, I go to Uganda. And these are some of the things I'm looking at to build capacity when it comes to reconstruction.
You've just now expanded our conversation to much broader than Restore, but obviously it ties back into Restore, because my next follow-up question is why? Is it because of the education capacity? Is it because it's not popular to actually study to become but I would think that being a doctor of some sort and going into plastic surgery is an integral part in terms of being able to solve and service some of society's most intimate needs. So when you're saying that there's not even one plastic surgeon, is it because of brain drain, where an individual gets qualified and then they leave?
You know what, I don't think they have training programs. I don't think they have actual training programs in some of these countries. You know, I remember when I first started going to Ghana in 2008. Ghana at the time had a population of 25 million. They only have 5 plastic surgeons, and Ghana is one of the most advanced countries when it comes to healthcare. Sure. I had the opportunity to work with about 3 other plastic surgeons, okay? The training is a little spotty, meaning that they don't, at the time they had a training program, but they are only limited to certain cases that they actually do. And then they will go to Morocco, they will go here, they will go there. A lot of these places they go, they are now even allowed to touch patients. You observe, how can you ride a bicycle when you're not actually on the bicycle learning how to ride? So this is most of it. It's not a brain drain. I don't think they are trained, and then they go to, you know, they leave their countries and go. They don't have training programs. Right now, I was working with Gabon 2 years ago, looking at ways to bring heart surgery. You know, also as a healthcare consultant, we look at countries, and when countries will call us to say, hey, we have a shortage of this, or we don't have pediatric surgeons. And we design programs to do that. So, for example, Gabon, and I use Gabon, you know, great country, great resources, great leaders, 1.2 million people, they don't have a heart surgery unit. So most of their patients are coming to South Africa, Morocco, France, Belgium, and it's estimated we spend about 12 million. We designed a program that was going to cost about $30 million, and $30 million we're going to bring professionals to live in Gabon and train them. So
then how does the person actually capacitate and support your organization? I mean, if you're a private sector, or if you're a government official, or you have a government agency, and you're listening to this and you're thinking, it's scary to know that certain countries do not have surgeons. So in that instance, how does somebody get in touch with your organization and say, listen, Restore, how do I help?
So, you know, Restore is free. Restore, we come to countries, everything we do is free of charge to the patients. Yes, you can go on our website, www.restoreworldwide.org. RESTORE, worldwide.org. But, you know, Restore is very different from Global Health Solution, the consulting arm of what we do. The consulting arm, we need to look as a country, as a continent, what some of the needs are. Okay, for example, I don't know all the things South Africa has, but we lack specialties in certain things. And for those of you who are in healthcare, and for those of you who want to help, you know, I think public-private partnership is the key to go. Yeah. All the stakeholders need to come on board, sit at the table, so that we can discuss some of these issues. For example, you know, you travel around Africa. Of course, South Africa has always been deemed a good place for medicine. But, you know, if you look at some of these African countries, people are dying because of lack of oxygen. They don't even have oxygen in some of these hospitals. Sure. You know, and you know, a lot of the wealthy people, I tell them, you know, I sit down and I'll have lunch, dinner with them, and I'll say, what do you think you're going to do in the middle of the night if you can't breathe? By the time you summons your private jet, you only have a 2-hour window if you're having a heart attack to get help, and you're not going to make it. You know, so I think we as a society, we need to start looking into healthcare. We need to start deeming health as a priority, because I believe
one priority, and be more aggressive in it. You and I can talk a whole day literally about healthcare.
You know, I believe that, you know, a healthy nation is a wealthy nation.
A healthy nation is a
if you don't have health, how are you going to create wealth?
That is very true.
So we need to put emphasis on our health.
On that note, we're going to leave it there, and hopefully you've learned something today about healthcare. Speaking to Dr. Michael K. Obeng, just looking at Restore as well as the phenomenal work that it does. They're joining us all the way, and he's been really deemed as the #1. He's saying plastic surgeon in Beverly Hills, but of course not losing the African identity with that.